answered this question. I don't want to talk about it. Hi, my name's Amy Cowperthwait. I am the CEO of Avkin.
And I'm Amy Erol. I'm the COO of Avkin.
And we're here to answer some of your questions about Avkin. So let's get started. What wearable simulators does Avkin have? So we started with the AvTrach. That was our very first product, and we have multiple different simulators. We have the AvTrach, the AvCath, the AvStick, the AvLine, the AvThor, the AvTone, the Avbirth, and we also have an Avband, which is not necessarily a wearable simulator, but a three-way communication device. And many blood, sweat, and tears going into those products for sure.
Who works at Avkin?
All right, that one's yours.
Oh man, we have a really solid group. We have a sales team, manufacturing team, an R&D team that actually develops and makes improvements on the products in-house. And then we have a marketing team and an education team to support our customers, as well as a QA customer service team as well to support.
Yep, and the administration to make sure the bills get paid for sure,
yep.
And that we get paid. I would also add in the idea that the manufacturing team does manufacture the products here in the United States. It was just something that we were really committed to the quality and making sure that the products were good quality going out the door every single time.
All right.
Can moulage go on Avkin products? Oh, this is a frequently asked question for sure. Yes, in fact, we moulaged one of our AvSticks because of the high-grade silicone. We moulaged one of the AvSticks, and then I left it in my car for a weekend, and it was like 90-degree heat, and tried to get it off, and it just wiped off super easily. So you can moulage our products. We have done multiple different things for our products, but it is very realistic and looks amazing and easy to remove as well.
And I remember when you were testing this, you also tested like permanent marker, pen, all of that kind of stuff, and that all came off as well.
Yeah.
You were very skeptical going into that test, but it worked out.
Yeah, and as simulationists, we know that pens are a no-no in the sim center because if it does get on some of the other products, it will stain for forever, but that was not the case with our products for sure.
All right. Are Avkin products automated? Yes. Yeah. So the Avkin products all have haptic feedback in them, which means that when you do something that would be painful to the patient themselves, so say you're suctioning too far down and you hit the carina, or if you put the needle in the skin for doing an IV start, they all have sensors in them, so it alerts the wearer that they should be responding with some sort of signal, with pain, coughing, anything like that. So all the products have that in them, and then our Avbirth, our newest product, also pushes the baby out automatically as well.
Yeah, and I think that was a common question that we got when we first released the Avbirth, was the automation on that, but it is fully automated. You control it by an app. I think one of the coolest things that our customers love about our products is the fact that we do have an app. It's a free download, and anybody can interact with our products in that way. The other piece of that is the haptic signals are fully automated. In other words, if the procedure is done in a certain way, regardless of what it is, it will automatically signal the SP. You as the facilitator don't have to do anything to make that happen.
Yeah, that was a big thing when we first started the company. Amy was a simulationist, I was a sim tech, and one thing that Amy really stressed when we started designing the devices was that the facilitator would not have to do a lot of work in the control room. You already have so much that you have to do. So when we do the designs, that's something that our R&D team is always considering. What can we do to make it easier for the facilitator?
Yeah. Changing heart sounds, lung sounds. Again, ask me how I know, right? I mean, it's just years of experience and just some of the struggles that I had when I first got started in simulation, for sure.
What does Avkin mean?
This is a test for you.
Okay. So Avkin comes from two Latin words, which are akin and vera. And what it means is close to the truth. So what we were trying to do as a company was get as close to real life as possible. So those two words together really spoke to us and what we were trying to do as a mission.
And the avkin.com was available when we were creating the company.
That helps. All right. What is the difference between Avkin, Avbirth, and contraction simulator?
Oh, so like the contraction simulator that they have males try on to know what it's like to have birth. So
we get asked that a lot.
You could actually probably use both at the same time so that they could see what it's like to have that, larger belly and feel the contractions, but that's not really what it's intended for. The Avbirth is really intended to be a product that is in healthcare education and is really meant to bring that human component into healthcare simulation, but at the same time be able to create normal and abnormal or, irregularities in the birthing process. The contraction simulator is really meant to give people that have not had contractions a sense of what it is like to have contractions. So our product is really not for consumer use, and that one is, I would say.
One thing we get asked a lot when we're doing demonstrations is if our products are actually hurting the person who's wearing them, which just really speaks to how good actors and actresses are. But they never hurt the actual person. All it is like a cell phone vibration that either vibrates on a strap of the device or on the Av band when they're wearing the Av band. But they just have really good reactions, and that's why it looks like they're actually in pain.
Yeah. So it's an inconspicuous cell phone vibration that typically the learners would not see or know that it was happening, but that the SP is cued at the right time. If you think of contractions kind of waxing and waning, it gives that full effect to the SP, but hopefully the learners are not seeing that at all. And that was another one of our criteria as we were getting things started with the company.
We should try answering that question and just be like, yeah, they do feel pain every time, and that's how we get those responses.
I don't think we'd have a lot of people purchasing our products, for sure. Yeah. Do we have any more questions, Nate?
Yep.
Okay. Here we go. Okay. You do better at holding this.
All right. Okay. Was Amy Buca Erol a sim tech?
Oh, you already said that one.
I was a sim tech. I was actually Amy's sim tech for a few years at the University of Delaware, and I really loved that position. It was really fun. I did a lot of things, other than just taking care of, not just, that's a bad sentence, other than taking care of the equipment. We worked a lot with like the inventory of the sim lab, just all sorts of things, and it was really cool to see like the diversity behind that position, but it was also really fun to work with all the equipment and to learn how they will equate to good education.
So a couple funny stories behind that. I am not the most organized person in the world, so having her come in and try to organize me was an act of Congress, literally. And I could tell when I had either Manikin or AV equipment malfunction, and I would call her, and I would be stressed because I had students out in the hallway waiting for things. Whenever she started humming, I needed to just back off and walk away. That was her like signal to herself, but to me also, that I had flapped a little bit too hard about whatever the issue was. So that is for sure. The other thing that I think it's really important is Amy is an engineer, and she took on the SimTech position to learn more about simulation equipment because she was helping the engineering students at the university create our very first prototypes and our products. So she's been with this after the AvTrach was developed. So from the beginning, but her value in this was she saw it from the SimTech perspective, but also from an engineering perspective and what the needs were. So I think that unique mix of knowledge and experience really helped us build a sustainable product as well as a company that is meeting the needs of the simulation community.
I didn't realize I did the humming thing until you told me that she ever, and I was like, oh, I definitely do that still.
Yes. She doesn't do it as much here, but she definitely did it in the sim lab.
The other thing that happened when I was a sim tech that I bring up a lot when we're doing like development work and stuff is during the summer, and I know a lot of you sim techs do this, I had to clean all of the equipment. And we always talk about not using organic substances in our devices. Like, don't put pudding in the AvTrach in general because it gets gross.
Ask her how she knows.
And the reason we know that is because that's what Amy did when she was doing trach sims at the University of Delaware. So I was cleaning the Manikins one of the summers, and I was trying to clean out the lungs that had just like mold growing everywhere. And I ended up cutting out the lungs completely from the Manikin because I was like, this is hopeless. There's no way that we're going to be able to recover this. But since then, when we were developing the products, we made it so that everything was able to actually be fully taken out, cleaned out, parts replaced, all of that stuff, because it was just like such a gross experience.
Yeah, and we worked with the chemistry department on that one to make sure that all of our products were antimicrobial, antibacterial. But that's just to say how much I prioritized the realism and the authenticity. Like, if you're going to suction a Manikin, we got to at least have them suction something out to be able to document on it, to be able to talk about consistency. Are they suctioning until clear? Needless to say, it didn't work out so well, but it was one of the impetuses for us getting started with our products.
Yeah.
Oh, this is all about you.
It's all about me. Oh, crazy sim story. All right. Amy Buka, Erol, crazy sim story. So a lot of the time when I was a sim tech, I was hanging out with the maternity simulators, just because they, are a lot more in depth and require, someone to actually be there the whole time when you're running the simulators. And we did have, I think it was like an entire semester period of time where something was going on. I still don't actually know what was happening with it, but the baby would birth and then go back into the device. So every time we do that, the instructor obviously was like, okay, well, can you figure out why this is happening? But we would always be like with the students like, okay, and then we're going to pause, and clearly that wouldn't happen. We're just going to move past that. But I did have to send that device back to the companies for repair, and because I'm small and it was a very heavy device, I used a patient lift to get it off the bed and into the boxes that I needed to and everything like that. So you figure out a way with your SimTech hat on. And
I will say I didn't have anything to do with maternity. My background is emergency department, so that was not my area of expertise. And I also, the interesting story behind that is that a customer that recently bought our Avbirth said that the product that they have, I don't know which one it was, but that every time it's a shoulder dystocia. So it's kind of how you're describing that the patient, the mother is having a shoulder dystocia birth because of the product that they had. So it's probably something like that where there's just some kind of programming or something. The
baby came out and then would suction back in, and we were like, that doesn't normally happen in real life.
Yeah, for sure.
All right. What is Amy's favorite book? All right, well, everybody knows this. My favorite books are the Harry Potter books. I reread them every year because I really like them. And my favorite of the Harry Potter books is the fourth one because it's a big competition and I'm very competitive. All right. Amy's favorite Avkin simulator. The Avbirth's a lot of fun, but it's not my favorite. My favorite one is the AvStick. Because I have a really big history with the AvStick. So when we first started the company and we released the trach, and then we released the cath and the stick pretty shortly after. And with the stick specifically, we really struggled at the beginning with finding something that worked well for the customer with the stick, that was really easy to use. Whenever you have pressurized fluids in a system, it just becomes really complicated. And then we needed the look to look nice. We needed it to be able to get blood all over it and still be usable after they got blood all over it, because some students, when they stick it, they might have a little blood come out. Because that happens sometimes. So we had a lot of iterations with the stick. It was really working hard with the customers, with our developers to get something that works really well. But once we were able to get through that, we were able to release a product that works really smoothly, and once you set it up, it functions really well consistently, and it was such a painful start. So I'm really proud of it, and it's a fun product to work with.
Yeah. And I'll say this, that as far as the products go, she put the most blood, sweat, and tears, definitely, I think, into the Avstick. Maybe the Avbirth too, because it's just it's a bit more complex. But just personally, so much effort went into that from her perspective and from our perspective. But it's also a testament to what we do as far as getting customer feedback and acting on that. I can remember so many times I would give feedback about the products that I was interacting with, and nothing would ever change, nothing would ever improve, or there would be nothing giving back. And so as a simulationist, it was so important to me, and I think to us, that we were acting on that feedback. And I'll say to Amy sometimes, like, when can we go to do injection molding on a certain, part that would make it easier? And she'll always say, when we stop making changes based on customer feedback. So just know that we do take customer feedback very seriously, and we do want to be here for the simulationist. It's not about necessarily just pumping out products, but it's about making those products work within your sim center. So that is really kind of one of our foundational or cultural principles for sure. All right, board number 3. It's going to be about me.
Ooh.
All right. Here, maybe better at that. Okay. How many CEO? Okay, so I didn't know anything about being a CEO or running a business when we first got started. I didn't have a business degree. I didn't have experience with business. As nurses, we're typically not trained for that. I got my master's as a clinical nurse specialist, but that really didn't help me as far as starting the business. So in order to gain knowledge, I listened to, because I did audibles as I was walking for exercise, but listened to over 250 books on entrepreneurship, getting companies started, women in leadership, the art of negotiation, all those kinds of things, which were skills. And the funniest thing is that I think walking helped, because there was my blood was circulating as I was listening to these books. And I can always remember certain things that are said. I never remember what book it was in, but I do definitely remember consuming a lot of information. And the early team, and Amy was a part of it, got to hear all of my latest rantings based off of whatever book it was. And there's some things that have stuck over the years for sure. But it is very interesting to be able to even draw on knowledge now as a company has grown that I listened to or heard or knew about beforehand. I would say probably The Art of Negotiation was one of the books that was really important, but probably still a big struggle for me as far as negotiation. I am pretty transparent and shoot from the hip, and so the idea of kind of holding back something or negotiating something and, not necessarily being completely transparent is really hard to do for me, for sure.
Depending on which business book that you were reading, you would come into our team meetings, and that was what we were going to run with for that day. So the other a few months ago,
depends.
A few months ago, I found notes from our early company meetings, and it was what was it, Scrum? Yeah, so there was a lot of meetings where it was okay, we're gonna do the Scrum strategy, and it was because Amy had just read the Scrum books, and she was we're using that word. But then you see a transition where a few meetings later, there's a new agile, I think was a new word, and it was now we're doing agile.
Quarterly rocks.
Quarterly rocks. Yep.
All that stuff.
Yeah, so it was definitely a this is what we're focusing on right
Vision
now.
Traction Organizer, that's another one. Mm-hmm. We still use that today.
Yeah.
Some of it helped. Some of it was we weren't ready for it yet, but it definitely helped prepare us. At least me, I felt more comfortable with it.
We had to try and see what worked for the company, and it changes as you grow. So something that worked, when we were a team of 15 doesn't work now. So we had to learn that.
And when we first started, it was a team of about 5. So.
Yes. Amy Cowperthwait on Dr. Oz.
Oh, yeah. Well, so the funny story behind that is that I was so excited because they had contacted Avkin and wanted me to be in a contest. And so this was the Shark Tank episode of Dr. Oz. And I got to compete against another nurse entrepreneur. It must have been Nurses Week or something, but they were very, very nice and, you know, very, very excited to have us on. And I definitely thought it was a competition. So Damon John was going to be the shark, and I definitely thought I was competing for this golden stethoscope. But when I got there, they had like a set set list of what happened. And at the end of that set list, it has, and both of them win the golden stethoscope. So it kind of took all the air out of my balloon as far as competition goes, because I didn't realize that we were both going to get it. But Megan was actually the patient that was wearing the trach, and I had one of my nursing students there, and they were suctioning. And we got literally, I think, 15 seconds to explain what this was. And Dr. Oz actually tried to suction the patient, Megan, but he wasn't doing it right because he's a surgeon. But anyway, at the end of it, Damon John literally had no idea. He's like, I literally have no idea what you do. So I did reach out to Damon John and say, hey, can we meet up so I could explain it to you further? And he never contacted me back. But it was really good in the beginning to have kind of that, reputable opportunity to have Dr. Oz. And I'm not allowed to talk about it yet, but we're going to have something very similar coming up soon. So stay tuned to the Avkin Press, because we will be keeping you in touch about that. That was a pivotal event. I literally shed tears at the 2016 NLN conference. At the time, we were still, we had a name and we were trying to get the word out. We always brought the AvTrach there, and we're doing the actual suctioning and got a lot of really positive response. But we had some very influential key leaders that came up to the booth at the same time, or close to the same time. So Carol Durham came up, Susie Cardinal-Egren came up, and Teresa Gore, who was at that time the president of Anaxel. They all came up to the booth and were just gushing over what we were doing. I obviously knew them from previous to this, because I was an Anaxel member and was actively involved. But they came up, to the booth at first. They left, and I literally shed tears. And I think it was because my concept I was so validated by what they were saying, and so validated that they thought that this was, really cool. But they walked away, and when they came back, I was crying. It's gonna make me cry now. But they asked me to be they wanted to give me the very first inaugural Hayden Vanguard Award, and that award was given to a simulationist that was making a meaningful difference in simulation education. And that meant so much to me. But it was the first time that I had ever really presented to a large group. I had done small group presentations at conferences and things, but there was about 3,000 people. And I can remember asking my sim sisters, so my NLN group came to the Anaxel conference, and I asked them if they would stay till the end to go to this, because it was an EndNote presentation. I asked all of the Avkin team to stay, but it ended up that there were so many people there, and it was just such an honor to be able to do that, and especially because it's really named in honor of Jennifer Hayden, who was really the leader of the NCSBN study on simulation in nursing. And so I felt very honored that they would choose me for that very first inaugural award, for sure.
All right. Oh, I don't know the answer to this one. Childhood nickname.
Oh, I don't want to talk about it. Why do you guys do that to me? I already answered this question. I don't want to talk about it. I will say that at a young age, my nickname was Mouse. And that was because when I would sleep, I would take all of my toys and put them under my stomach. So that's the only one I will reveal. Some of them were very scarring. Think about middle school names that people call you. It's not nice.
All right. Does Amy Cowperthwait have a podcast?
Yes, it is. I do that in conjunction with Megan, and it's really based on advances in simulation and trying to help other simulationists make a meaningful difference in their professional careers, and helping people get SP programs going. The name of it is called Simulation Nation, and so we invite you to join us. We try to put them out about weekly throughout the semester. We do take breaks in between, so summertime and wintertime, we do take breaks, but please join us. We've had a lot of really positive feedback and comments about what we're doing there.
Where is Amy B from? I am from Pennsylvania, from a little town called Cungy, and it's right outside of like Allentown, Pennsylvania area.
It's a very cool architectural antique shop.
Mm-hmm. Yep. Where is Amy C from?
I have a couple of different spots. I grew up predominantly in State College, Pennsylvania, which is the town that Penn State's in. So I grew up as a Penn State proud, but never went to college there. I went to college at the University of Delaware. So I spent my high school years in Delaware and went on to the University of Delaware for nursing school. But I would say I'm from State College, Pennsylvania, most likely.
Where did we meet?
Met at the University of Delaware. So I had many years in the emergency department as a nurse and went back to my alma mater to take on the coordinator for the Skills and Simulation Center in 2006. And then Amy joined me in 2013?
Yeah, I think the end of 2013.
Somewhere in there. So
Yeah, and I went to the University of Delaware for mechanical engineering, and I got my master's there as well. And I remember we specifically met in a coffee house. That was where you were interviewing me, and I was asked recently if that was intimidating, and it was not.
I was going to say, it wasn't really an interview.
It was a very casual interview.
But the way that we met is through a mutual friend. So Jenny Buckley was working with the students to help develop the very first prototypes. Again, at that point in time, early on, I had no intentions of starting a company. But as we began to try to think about licensing or shopping it around, I began to embrace the idea a little bit more. And Jenny knew I needed help and thought of Amy and introduced us. So. Yep. Our very first meeting was actually at the coffee shop. Jenny wasn't there, but she was a mutual friend for sure.
Mm-hmm. Oh, answer this one. Where did Amy and Amy go to college? Both of us University of Delaware grads.
Yeah.
Okay. Where is Avkin located?
So we stayed in Delaware. Most companies don't, they're incorporated in Delaware, but don't actually manufacture or sell out of Delaware. We actually started in Delaware, and a business partner had a different business with her husband, and she incubated us in the upstairs area. It's about the size of a one-bedroom apartment. We stayed there for at least 2.5 years, and then ended up moving here to Avkin right before COVID, and thank God we did, because we would never have been able to work and manufacture products in that small space. So
we were there for 4 years.
4 years?
4 years.
Wow.
So our manufacturing started, we were in a small room. That's where our manufacturing started in. And then we just kept on like taking over additional rooms. But we were, growing way too fast for the space. So we ended up having to move. And once we moved, we were in a huge space, and we were like, we'll never fill this out.
Yeah.
And it got small too.
Yeah, for sure. So think of like 725 square feet to 9,999 square feet. And we literally, I said, we could sublet some of the space because we don't need it all. And then, just a few years later, we're looking to figure out how to rearrange things so that it would make sense. So the growth for Avkin has been amazing and so exciting to see and watch, but it is definitely surprising that we're burgeoning at the seams here with 999 square feet. Yeah. Last question.
Where are Avkin products made?
Right here. Right here at the Avkin office. If you want to see where it's made, we do a quick tour of the Avkin office in a different presentation or video. So look at the questions video. You'll be able to see a quick tour of things. But we manufacture it right here. Again, we were very committed to quality. All right, that's it. Thanks, guys, so much for joining us. And we'll get together another time if we have more questions that come in from you all. Thank you.